Hi, everyone, and welcome back to Health Equity Conversations. I'm Deb James, and happy Nurses Week to my fellow nurses. Now, in nursing, we're taught that pain is the fifth vital sign. We're taught that pain is exactly what the patient says it is. But what happens when the healthcare system doesn't believe everyone equally? Today, we're tackling a critical but often overlooked issue in medicine: how pain is treated unequally across races and ethnicities. It's an uncomfortable truth, but we can't fix what we refuse to face. So let's uncover the facts. Pain is extremely and entirely subjective. There's no blood test, no x-ray, no scan that can definitively tell me as a nurse exactly how much pain you are in. I have to rely on your report and my assessment. But systemic studies show a heartbreaking reality. Certain groups consistently receive less effective pain management. And the data is glaring when we look at Black and Brown patients compared to white patients. Now, as healthcare professionals, we believe in patient safety and advocating for our patients. However, implicit bias, the unconscious stereotypes that affect our understanding and actions, repeatedly creeps into pain management. This means that a non-white patient rating their pain as 8 out of 10 might not get the same intervention as a white patient with the exact same rating. And this is a massive failure in our healthcare system. So let's look a little bit at the evidence and some of the myths. So studies show that after surgery or traumatic injuries, Black patients are significantly less likely to be prescribed opioids or other appropriate pain medications. Even for severe conditions like bone fractures, this disparity is well documented. In fact, a 2016 study revealed that half of white medical trainees believe myths, including Black people's nerve endings are less sensitive than whites, and Black people's skin is thinner than white people's. Therefore, Black people literally feel less. Let me make this perfectly clear. This is a biological myth based in eugenics. It has zero scientific basis, and it has incredibly dangerous consequences for patient care. Let's look at the evidence from a 2019 study of medical school students in New York. Students often resist targeted instruction in implicit bias and recognition and management. Study analysis suggests a range of attitudes about implicit bias instruction and factors that may influence these attitudes, especially resistance. Resistance mainly comes from anticipated shame within the learning environment, meaning, what will other students think about me admitting that I have implicit bias? Resistance attitudes were also influenced by lack of relevancy, lack of motivation, and no confidence of shifting their perspectives. Doesn't matter to me, don't care. So what? Little guidance exists for overcoming attitudes and how to engage students in implicit bias training. That's the problem. We can provide the training we want, but if we can't get past that resistance, it does no good. So, what is the impact of all of this? Undertreated pain is more unnecessary physical suffering. It actually hinders the healing process by keeping blood pressure high, delaying mobility, and causing severe psychological distress. Furthermore, when a patient comes to a healthcare professional and their pain is dismissed, it deepens a historical mistrust in the medical system. Change comes through action. We need better standardized pain assessment protocols that leave less room for bias. We need mandatory, continuous Let me repeat that: continuous implicit bias training for all healthcare providers. And importantly, we need patient advocacy. So, what does all this mean? Bottom line, we all deserve compassionate, effective pain treatment. Pain doesn't discriminate, and neither should treatments. Understanding these disparities is a huge step toward fairness and true health equity. Have you or a loved one ever felt dismissed when reporting pain? Let me know in the comments below. If you're not comfortable leaving a comment, contact me directly, message me, and I will return your message within 48 hours. If you find this video helpful, please share. We need to get this conversation out there. Don't forget to like, subscribe, and hit the little bell icon to stay updated on our latest health equity videos. Thank you so much for watching. I love connecting with you and building community. I'll see you next time. Bye.